when it comes to hormone imbalance, it can get really confusing really fast when it comes to what supplements should you take. Because each hormone imbalance is going to take a little something different, and you really want to be sure that you're on the right supplements depending on what hormone imbalance you have. So if you head over to karenmartel.com/shop, you're going to see my new support kits for women's hormone imbalances. We've got ones for insulin resistance, so it's the insulin support kit. We've got the thyroid support kit, which, yes, you guessed it, is for women with hypothyroidism and that need support for their thyroid. We've got the adrenal repair kit for women with low cortisol, and we have the Be Calm kit for women with high cortisol. These kits have everything that you need in order to help support these imbalances and help repair them. So right now, all of our kits are on sale, and each of them come with a free 30-day meal plan. So that's karenmartel.com/shop, and that's our women's wellness store and our hormone support kits. All right, let's get to our show. You're listening to The Other Side of Weight Loss. I'm your host, Karen Martel, transformational nutrition coach and expert in women's weight loss and hormone health. If you are ready to go beyond diet and exercise, then tune in each week to hear from leading experts in psychology, nutrition, and spirituality as we explore the many avenues of what it really takes to lose weight and feel your best. Hey everyone, welcome back to the show. Today we're going to be talking about something that I haven't really talked about here on the podcast, which I think I probably should have by now because it's a serious growing epidemic, I do believe. My guest is going to tell me whether or not that's true. We're going to be talking about PCOS, Polycystic Ovarian Syndrome, and just its role in women's hormone health and what causes it. We're going to be diving into how does it affect a woman while she's going through menopause and perimenopause, and how it can show up in those years when you may not have had it earlier, what it does with fertility, and so much more. My guest today is Dr. Nadia Brito Pateguana. Hopefully I said that right. We practiced beforehand. Her website is thefastingmethod.com. Nadia is a naturopathic doctor, dietary coach with the Fasting Method by IDM. Works alongside Dr. Jason Fung and Megan Ramos, helping people with metabolic syndrome with intermittent fasting and low-carb, real food dietary management. Her focus has been on women's health for over 16 years on diet, PCOS, PMS, fertility, pregnancy, postpartum, and menopausal health. So welcome, Dr. Nadia.
Thank you. You said that perfectly.
Oh, I did. Yay. Well, I do speak a little Spanish, so I can do the accent, so I think better than most people.
Yeah,
Hopefully. Yeah. So Nadia, like I said, we haven't talked about this much before on the podcast. So I think just to start, because a lot of people aren't familiar with what polycystic ovarian syndrome is, and we can call it PCOS for short. Can you just tell us what that means? What is it?
So PCOS, polycystic ovarian or polycystic ovary syndrome, is first of all very common. So most people, when I talk about this, I ask for a show of hands. We get like 80-90% of people putting up their hand. Most people have heard of it. So they either know someone who has it or have heard of it for whatever reason. So it's pretty common. It's actually the most common endocrine condition in women during their reproductive years.
Wow.
And so that's a big thing. So it's common.
Mm-hmm.
First and foremost. And we're looking at anywhere from 10 to maybe even 30% of all women in their reproductive years. It's a lot, and maybe even more. So one thing we know is that it's common. The other thing that we know is that it's probably underdiagnosed. So maybe there's even
I was going to ask that. Yeah.
Yeah. And it's debilitating, meaning it's a bit of a bother, as we'll talk about, but it's very serious. So this is the main reason why it needs to be addressed. And one thing that's happening, unfortunately, is because conventional medicine doesn't have a good grip on treating PCOS, and a lot of women are getting diagnosed. I'm getting women saying, well, I just got diagnosed with PCOS. I looked you up and your name came up. And my doctor said, don't worry about it. It's very common, no big deal. you don't have to do anything about it. So this is the state that we're in. So it's common, debilitating, and we can talk about that if you'd like. And it's serious, very serious, unlike what many people are being told, and that's unfortunate.
And I have read too that it's the leading cause of infertility in women now. Is that correct?
The highest, yeah, high in ovulatory. So people that have ovulation issues, it's the leading cause of infertility for women. If ovulation is the issue, then it's likely PCOS.
Right. And so
about
can
80%.
you explain what it is? Like it cysts on the ovaries?
So PCOS, as you said, is a hormonal condition, right? It's an endocrine condition, and it's a reproductive condition, but now we know it's also a cardiometabolic condition. So it's related, and it is related to metabolic syndrome, which encompasses obesity and diabetes and metabolic issues, right? Like heart disease and things like that. So it is a ovarian condition. So it's like a localized metabolic syndrome of the ovaries, but then unfortunately it leads to a much higher risk of all the associated cardiometabolic conditions, right? Like obesity, diabetes, heart disease, etc. So how it develops it's a tough question. And what causes it is also a tough question because it's likely multifactorial. Okay. But we do know that at the root cause of it, right, is high insulin, hyperinsulinemia. And so this is how it relates to obesity and diabetes. So we know that high insulin is what's causing the 3 diagnostic criteria of PCOS, which basically is polycystic ovaries. So in order to be diagnosed with PCOS, you have to have 2 of these 3, okay, which is polycystic, meaning many cysts on the ovaries, and this you can see on ultrasound. And many women have polycysts, and that doesn't necessarily mean you have PCOS. So even quote unquote, and I don't like to use this term, but as they say, normal women can have many cysts on the ovaries. So then it depends on the number of cysts and the size of the cysts, and that can be seen on ultrasound. The other thing is irregular menstruation. So a regular menstrual cycle is 28 days and comes every month. And so anytime you have less than, I guess, 8 cycles, and again, your doctor would go over this with you, or you can look this up. I don't want to be making diagnoses, but it's 2 out of these 3. And the third thing would be expressions or laboratory findings of high male hormones, which are called androgens. It's not just high testosterone, it's also low, it's another hormone that's low, produced in the liver. And all 3 of these can and probably are caused by high insulin. And I did a review for the Journal of Insulin Resistance called The Contribution of Hyperinsulinemia to the Hyperandrogenism of PCOS. So all that means is how much does insulin contribute to these high male hormones in PCOS? And it contributes immensely. It contributes to the cysts in the ovaries. That's probably what causes it. We go through the science of this in our resources and in our book, and it contributes to the irregular period. And it contributes to the expression, so not just lab finding of male hormones, because it's kind of hard because hormones vary a lot during the day and at different times of your cycle. So you don't necessarily have to have high male hormones on labs. The expression of it is very obvious. And anyone who has PCOS or has heard of it knows, you've got the acne, you've got the hirsutism, which is the abnormal facial and body hair growth like men. And so in women, it's abnormal, right? To have hair, upper lip, chin, belly, in your behind and all over your body. You can clearly see when you have it. And then the abnormal male pattern baldness, right? Again, very obvious in women when women have this. Yeah. And so women can see it and they come to their doctor. And then if they have 2 of these 3, they get diagnosed with PCOS.
Right.
Obesity and diabetes is actually not part of the diagnostic criteria, but as I said, it often women with PCOS that are much higher risk for this. And it's not because PCOS causes obesity or obesity causes PCOS, and the same with diabetes. It's because they have the same root cause, which is high insulin.
Right, which is high sugar intake in the diet, correct?
As well, yes. Well, one of the main causes, probably for hyperinsulinemia, it definitely was for me, was a very high sugar intake throughout my young life. But there are other things that raise insulin.
Did you have PCOS?
Yes, I did. Very much so. Not only did I have PCOS, but I developed almost all of the very serious conditions that we talk about. So I developed obesity eventually, hypertension, diabetes, cancer, and all of these other things. So it was pretty prominent in my life. I had fertility issues, I had pregnancy issues, and I had postpartum issues. And unfortunately, my children were affected by it with metabolic syndrome because
Wow.
I was a woman with PCOS and metabolic syndrome who got pregnant and didn't resolve it.
Okay. So then your kids were born with insulin resistance.
Well,
With
definitely at a
high.
much higher, and they have been. One of them, well, both have been diagnosed with metabolic syndrome, and they're 9 and 6.
Wow. Hey, was this before you became a naturopathic doctor?
No, my kids are just 9 and 6. I became a naturopathic doctor way, way, way long ago. And when I started practicing, I practiced somewhat of a conventional sort of dietary approach. I didn't know, I knew as much as I was taught, and then I started to learn.
Right.
The eat less, move more approach, I think, was my initial approach. 10 years ago was when I was diagnosed. Actually, now probably 11 years ago was when I was diagnosed with PCOS because I was trying to get pregnant. Remember, I said my kids are 9 and 6.
Yeah. Right.
And luckily for me, in my first few years of my career, I started to know, and this is part of my funny story in the presentations that I do in the book that we wrote. Um, Somehow I got known as the baby doctor because people were getting pregnant when they had fertility. They weren't coming to me to get pregnant. They were coming to me to lose weight, and then they were getting pregnant. Because eventually I started to change my dietary approach, and I started to go very low carb very early on, and a long time ago when people weren't really doing this, and women were getting pregnant. And so it became this big, like, what's going on? And I would say, oh, it's a detox. It's a detox, because I didn't know. And then I was diagnosed with PCOS, and I thought, okay, I need to figure this out, because now I can't get pregnant. And I know that this dietary approach I'm giving people is helping them get pregnant. So then I did it myself. I followed this very strict low carb diet, and I got pregnant. And that happened a second time. And so that's been my journey. And
Wow.
I've learned a lot in the process, of course. And I'm trying to share it with people.
Yeah. Oh, wow. As if that wasn't meant to happen to you, though. That's what I think. Like it was your path. Like it was like somebody was forcing your hand into that path. That
You
here we're going to
know,
give you PCOS so that now because you need to learn how to fix this so you can help others.
Karen, I always say, PCOS is, as I said, as I started this, it's common, it's debilitating, and it's serious. But in a way, it's almost been a blessing in disguise. I wouldn't have
Yeah.
learned all the things I've learned today,
Yeah.
and I wouldn't have healed in such a way if it hadn't been so serious, if I hadn't developed all of these very serious things. Again,
Yeah.
in our book, I wrote the book, The PCOS Plan, with Dr. Jason Fung, who I work with. And in our book, he says, if PCOS was just about a few missed periods and a little bit of acne, then it wouldn't be such a big deal. But it isn't.
It's
It's
not.
very, very
It's
serious.
very serious. Yeah. I find it so interesting that when women have insulin resistance, that PCOS is part, like it goes in tandem with it. And when there's too much sugar being eaten, too many high carbohydrates, and then they start to develop the masculine features and testosterone goes up. And then for men, when they eat too much sugar and they've got hyperinsulinemia, they start to develop breasts, and their estrogen goes up. Like, to me, that is just like, what? That's
This is
crazy.
very true. And so what you're saying is exactly what we're saying. Insulin, which is the hormone that goes up when you eat a lot of carbs and very often, that's where intermittent fasting comes in. When you eat very often and you eat a lot of carbs, inevitably you're going to develop hyperinsulinemia, which may eventually lead to insulin resistance. And so what you're saying is the same thing that we're saying. So now we know that insulin isn't just a metabolic, or it doesn't just have metabolic functions, so obesity and diabetes. It is a very strong, has very strong reproductive functions. This is key.
Yeah.
It's key for females' health. It's key for males' health. It's key for fertility for both men and women.
Yeah. Do you see any other female hormones correlating with PCOS? As in, do we see more often than not estrogen dominance, erratic cortisol levels, anything like? Is there something else that you see a trend in as far as the other hormones go?
I think that's a good question, although my focus is on insulin. And the reason being is because it's something that we can control, right?
Yeah.
And how we control insulin through dietary approaches. Basically three main approaches when it comes to diet, although stress and sleep will affect insulin very much. But the three dietary approaches are how often you eat, what time you eat, and what you eat. So these are things that we can work on and we can lower
Right.
insulin. And remember that insulin really is at the root of all of these serious things. So PCOS, obesity, diabetes, and heart disease.
Because I
And
do,
maybe many other things, right? Cancer,
yeah.
I mentioned cancer. People are talking about Alzheimer's quite a bit and many
Yes.
other things.
Yeah, yeah. I've worked with a lot of women with hypothyroidism, and there does seem to be a correlation between thyroid and PCOS. And like women correcting their hypothyroidism, and then because it was related to their insulin resistance, and then because that gets fixed, their PCOS goes away. So I definitely think there's so much. They're all interconnected. So I think having PCOS is definitely have a hard hit on many hormonal levels for sure. So what are you seeing then as women go into the perimenopausal phase? Because you had mentioned that that's definitely one of your big things is it's not just about fertility, it's also about menopause as well.
So I think that that's a very good thing to bring up because I think people
Mm-hmm.
think, well, this is a reproductive issue. It's a fertility issue, PCOS. And so a lot of women with PCOS get pregnant. I did. It might be harder, but it's not impossible. And so maybe people will think, well, that's all I have to worry about. Either get pregnant or just not. If I don't want to get pregnant, then I don't have to worry about it. But you do. Because again, insulin and PCOS is not just a reproductive concern. It's a cardiometabolic concern, a serious cardiometabolic concern. And so it's a disease on a spectrum. So as you progress up on the spectrum, you're going to have a higher risk of all of these associated very serious conditions. So again, obesity, diabetes, heart disease, cancer, and all the other related things. If Alzheimer's is related, then that's going to be on your radar. And so as you reach perimenopause and menopause, you're much more likely to be affected by these things. I actually was affected by all the things that I told you in my 30s. So it wasn't even perimenopause. It was like, bam, bam, bam. I got them all. I was diagnosed with the frank type of PCOS. So I had all three of the diagnostic criteria,
Wow.
like many people that I
Wow.
deal with.
Yeah. So women they can develop it at perimenopause. I've seen it when women get their hormones tested and they've got, uh, weight loss resistance, and I see that their testosterone will be off the charts. And then I'll be like, okay, let's check your fasting blood glucose. And sure enough, it's always higher than it should be. And I see it quite often, to be honest. Like that, you can see low testosterone too, but I definitely see the high testosterone more and more so now than I did before. So I think it's a growing concern for women. I think they need to realize that you can develop it at any time. Like you said, it's a spectrum and it can start building. You may have had it going, in your 20s and 30s, and then you hit your 40s, and that's when it starts to really present itself.
I would think so, especially now that we've linked it to insulin, right? Your insulin
Mm-hmm.
resistance can get worse over the years, right? Insulin builds, and your fasting insulin can get higher, right? And does get higher, and especially the way people are eating, right? So we're eating more processed foods, more carbohydrates, and much more often, which really is the key thing. And this is why we focus so much on intermittent fasting. The more often you eat, no matter what you eat, you're going to raise insulin.
Right. So let's talk about the diet part of it then. So are you thinking that that it should be just the fasting part of it that needs to be implemented, or does it have to be a ketogenic diet or just a lower carb diet? What do you suggest that women do in order to get their levels back to normal again?
I think it's everything that you can do. Really all three of the things that I mentioned when it comes to diet. It's how often you eat.
Mm-hmm.
So of course that's intermittent fasting. What time you eat, and Dr. Fung calls this the critical importance of meal timing. And a lot of people are talking about it, the circadian rhythm of eating earlier in the day, lowering insulin, and eating later in the day, raising insulin. And that's a big problem because most of us in this modern life are eating late and snacking late, and and just eating foods, sitting in front of the TV and eating foods that you just can't stop eating, and creating these habits. So that's going to be a big one. And then
Mm-hmm.
what you eat. So does it have to be a ketogenic diet? Well,
Mm-hmm.
that's a very good question. In our book, we don't actually call it a keto diet. And I'll be very blunt about why. I think it's because there's a lot of keto products.
Yeah.
there's a lot of fake foods that are now called keto foods. So I would rather people follow a real food, low carb diet. And low carb is important because high carb raises insulin. Carbs raise insulin more than any other macro in comparison to protein and fat, right? But if you're following a fake diet with fake products that you're eating all day long, you're going to raise insulin all day long. So carbs are not the only thing that raise insulin, but they're one of the things that raise insulin. Eating too often, snacking. So we focus on full meals, rich meals, satiating meals, and real foods that you can eat, feel satiated, and walk away. That's called intermittent fasting. And eating as early in the day as possible. That's a big thing. Again, the circadian rhythm. Our hormones function in a circadian,
So do you mean like so you think eat breakfast like as soon as you wake up sort of thing? You said as early as you can in the day?
Not necessarily. And the reason earlier in the day is in don't eat late at night. So probably the ideal situation is you're eating before sunset. I would say that's pretty safe and makes a lot of sense. Not necessarily eat as soon as you wake up. You might be adding some fuel to the fire. People that are very insulin resistant or diabetics have that's called the dawn effect, have very high blood sugars in the morning. So maybe eating as soon as you wake up is not the best idea for these people, but really it also depends on what you're eating. So another big reason why it's probably a good idea to skip breakfast is because breakfast foods are full of carbs.
Yeah.
So if you're eating a very good, rich, low carb real food diet, then yeah, eating early in the day. And there have been human studies showing that people that eat at 8 a.m. and 2 p.m., that's it. So that's a very early time restricted feeding pattern, which is not very common, but the people that did that, and I have people that follow that, are the ones that do the best.
Yeah, I would do that if I didn't have kids and husband, because I feel that those are my hours to eat in. And I'm most hungry around 2:00 in the afternoon. So if it was up to me, I would probably have dinner at like 2 or 3:00 in the afternoon to call it a day. Cause that to me is like perfect.
And this is the same exactly. So because of, we're social beings, we have families, and because of life and work, people are eating later and later. Okay. But ideally, both you, your husband, all of you, your husband and your kids would be eating earlier.
Mm-hmm. And when it comes to fasting, I always like to get people's take on how often would you recommend doing it? Like, what are the hours that you would, should we be doing longer fasts sometimes, or do you just recommend just a daily, just like you said, like just having a shorter window? Like for some people, it might be from 10 till 5 or 6 or something. Just doing that daily, is that, and not having a lot of snacks, is that your recommendation, or do you like to do the longer fasts for somebody that's, needs to quicken up the process of becoming not insulin resistant?
All of the above. So it really does depend on your goals and where you're at. Remember that there's a spectrum. So I'll use me as an example just because this is what we've done. We've used me as an example in our book and just to get the conversation going. But at this point in my spectrum, I mean, I'm very comfortable saying that I'm at the very low end of the spectrum. I don't say that I've reversed my PCOS because, again, it's not my place to diagnose me or anyone else. I don't know if I still have PCOS or not. I don't have expressions of it. And that's fun. I have nice skin for the first time in my entire life.
Beautiful skin. Yeah.
Well, thank you. But I appreciate that, especially because I really struggled with that my entire life, right? And still, when things go off for me, I do, I'm human, I get this patch of not only acne, but a hair that grows around here. So I'm at the lower end of the spectrum. So what that means is I eat in a time restricted pattern. And I do so because I don't want to raise my insulin again. I don't want to go up on the spectrum. So I'm not going to eat 10 times a day, no matter what anyone tells me. I eat once or twice a day, every single day. But if you're way up on the spectrum and you have a whole ton of weight that you need to lose, and you've got no cycle for the past 3 years, which is the kind of people I work with, then eating 2 meals a day, great. You might halt things, but you might not. It might take a little bit longer to get to where you want. So yes, we have protocols that include extended fasting and include alternate day fasts. And it depends on really what people's protocols are. Fertility protocols are a little tricky because a lot of women are trying to get pregnant. And so we have to I follow, and I'm very attentive to this, sort of keeping track of their ovulation, right? Because you're trying to get pregnant. Often I will encourage that people do a 3 to 4 month protocol because you don't want to be like me. You don't want to get pregnant with PCOS and metabolic syndrome. You want to be you want to reverse this as much as you possibly can before you get pregnant.
Yeah.
You don't want to have the complications that I had in the postpartum complications, and you don't want your children to be exposed to all of this insulin. It will have an effect. So I often say PCOS women are not infertile. So if your wish is to get pregnant, that wish is likely going to come true, but you probably want to deal with this underlying condition, which is a lot more serious, right?
Right.
So that, I was talking about the ovulation because post-ovulation, we're not putting women on extended fasts. So, but before ovulation, you can. Why not?
Yeah, because I think that's an important piece to mention, which is if your body's in a fasted state, and quite often, then you could actually shut down fertility because your body thinks there's not a lot of food around and don't get pregnant, right?
So one of the big concerns that people have is miscarriage. But first of all, I've never told a woman post-ovulation to do a long fast. So I'm not concerned about that, number one. But what we're seeing is women with PCOS that get pregnant, that don't reverse their PCOS. They're not fasting. They're not doing low carb. They have a very high risk of miscarriage. This is one of the big pregnancy complications.
Right.
So again, it's not the intermittent fasting that's causing the miscarriage. It's
Right.
PCOS that's causing it.
Yeah, right. I think I just think that there's a lot of women right now that do fast to the point of starvation. I think that was what was my train of thought there is I do see so many women now that are like, I have one meal a day, and I just talked to a girl the other day. She's had one meal a day for the last year, and she's not looking very good. And I think like somebody like that's starvation. And then I think your body probably wouldn't want to get pregnant. So I think you have to, like you said, you fast, but then you eat well the next day, 3 meals a day, still healthy meals, but that you're showing your body that there's still food intake coming in.
It could be, and we come across all kinds of different people. I do a lot of one meal a day, and I definitely I'm not starving because I eat a very nutrient dense diet, probably
Right.
like you do. I do still eat a very low carb, appropriate protein, very high fat, healthy fat diet, and I only recently started doing a lot of one meal days. I used to do 2 meal days, but again, and so there's a big difference between fasting and starvation, two different things.
Mm-hmm.
But and we used to say fasting and feasting. We don't say fasting and feasting anymore because it also can get people on a different path, like a binging kind of path. And that's not what we're trying to say. So it's fasting and eating and fasting. It's basically an eat stop sort of thing. And for some people, it makes sense to do 2 meals a day. Some people make sense to do 3 meals a day. Some people make sense to do 1 meal a day. And some it makes sense to do an alternate day pattern. And on occasion, to do some longer fast for a reversal or healing. But it's not something that we encourage to do very often. Okay.
Mm-hmm. Mm-hmm. Yeah, I agree. I just got into the Walter Longo's idea, or what is his? I can't remember. No, the longevity diet. That's what it is. That was interesting. I've seen some very good results with that too. It's a fasting mimicking diet. That's what it is. But I've seen great results with that with some clients, and that was you're still eating, but you're mimicking what fasting does to the body. I don't know. What's your take on that one?
It's different than what we do. I'll put it that way.
Okay.
It's different. Yeah. We don't do fast mimicking diets. We do, again, fasting and eating. Okay.
Mm-hmm.
So I tend to stick to the idea of fasting and clean fasts, short most of the time, and then eating real food. And this has been my approach and our approach, the fasting method approach.
Can people get the results if they're not wanting to do a low carb diet? And let's just say they're just wanting to do, moderate carb, 50 to 100, let's say for a woman total a day, and then do fasting on top of that. Do you still see really good results with that?
Our program is very inclusive, okay? And we're very inclusive for a reason. We are not a ketogenic diet program. We are not a paleo program. And we believe, and we've seen fasting work with any diet. And really, this is the truth. It works with any diet. But how much more do you have to fast then if your diet is junkier, right? And what you're describing doesn't sound to me like a junky diet. It just sounds to me like a diet that has a bit more protein. And yes, we do have a bit more carbs, and we do have people that follow a diet. I wouldn't call it a high carb diet, but higher. They have the metabolic flexibility to be able to eat more carbs. I eat more carbs nowadays than I did before. I don't think I eat as much, maybe like you said, 50, maybe up to 100 on occasion. But again, the kind of carbs that you're eating will also make a big difference, right?
Yes. Yeah. Yeah. And I think people need to know that too, is it's going to affect each person differently. I get a lot of my clients to do carb tolerance testing where they're testing their blood glucose after they eat, 2 hours after they eat, just to see how that food affected them. Because some people that you can't really say like, no, you can't, you have to be 10 grams a day of carbohydrates. You may not have to be. It just all depends, right, on that certain what that person's metabolic health is all about.
This is very true. So how metabolically healthy are you and how metabolically deranged is somebody else, right? What we're seeing, and Nina Teicholz has posted this all over, studies and just statistics showing that I think only 12% of North American adults are metabolically healthy. So that means 88% of us are not. So that's a lot, right? And that, of course, that's not what it was 50, 60 years ago. And why is that happening? It's, of course, because we're eating too often and we're eating too many carbs and too many processed foods.
Yeah, exactly. And so what is your book all about, and who is it directed at? Just anybody with these issues with insulin resistance, or is it specifically for women with PCOS?
So our book is called The PCOS Plan, and it is specific for women with PCOS. It addresses what it is, what likely causes it, or again, insulin. We talk a lot about insulin, and we talk about how to reverse it, how to lower insulin through diet and intermittent fasting. So we do talk about a low carb, real food diet. It's very specifically, there's a very nice practical guide, if I may say so myself,
Yeah.
with the recipes and very detailed to help people through sort of a plan for PCOS. So it is specific to women with PCOS. But again, it talks about not just the fertility, but all the associated conditions. So you're right. You might be a woman who's perimenopausal or menopausal. And I work with a lot of women who are now in their 50s or 60s. And they say to me, I was never diagnosed with PCOS, but now that I speak with you and I've watched your lectures, I had PCOS, or I struggled to get pregnant, or I never got pregnant. And I could have reversed this. And now they have the associated conditions, right? Now they have the serious associated conditions. I have worked with numerous women, and this is a big thing for women, not all women, but many women, that they wanted to get pregnant. They went through all the fertility, whatever was available to them at the time, and they couldn't.
Yeah.
And now 20, 30 years later, we're saying, hey, it is actually this simple. This is what you have to do. And now they're doing it to reverse diabetes and to reverse obesity, but they didn't have the chance to do it then to get pregnant.
So when's the book coming out, and when can we grab it?
So it seems the last date I was told is April 14th of 2020, and I will be in Toronto for that release date, and hopefully doing some fun things around that week.
Yeah. And so you specifically work with the IDM program right now, so people can access you in your coaching through that website?
That's right. I work exclusively for the fasting method by IDM. So our current we have a newer website. It's, well, not new, but newer, thefastingmethod.com.
Okay.
And I am one of the coaches. We have a nice team, a bigger team, but a nice team.
Yeah. Okay, great. So people can find you at thefastingmethod.com. I didn't know they changed it from the IDM.
So IDM is still there, but IDM
is
our parent company, so IDM has other things going on in our coaching program. Our online coaching program is specifically now called thefastingmethod.com. So it's just to make things a little bit easier to navigate.
Yeah,
we have this great program. So besides the coaching, we also have it's a community. It's called a membership program that people can be involved. We have nice groups and group calls and group fasts and resources, education, and support for people that want to live this fasting method sort of lifestyle.
Awesome. All right. Well, thank you so much for coming on the show. And you guys heard it. You can find her book on April the 14th on Amazon, I'm guessing.
Yes. Yes. It's already available for pre-order. Isn't that awesome?
Perfect.
Amazon's awesome like that.
They are. Yeah. So there you go. You guys can, at the time of this airing, you could be pre-ordering it. So thank you very much for coming on the show, Nadia.
My pleasure, Karen. Thank you so much for having me.
I hope you enjoyed today's show. New episodes come out every Thursday, so be sure to subscribe so you don't miss any of them. You can also find me at KarenMartel.com, and you can get free recipes and weight loss tips by following me on Instagram and Facebook at Karen Martel Nutrition.